A bit about the agency you work with or that you run.
Okay, I'm responsible for 6 agencies. 3 of them are licensed agency and 3 are certified agencies. The difference between both of them is that the licensed agency provides paraprofessional like home health aides, and the certified agency we provide skilled care, nursing, physical therapy, social workers, any of the therapists like the therapies, and that's what we do. But that's the difference is that one provides paraprofessional and one provides skilled care, and we can bill Medicare and CMS Medicare.
Okay. And I think that is some of the things that we wanted to talk to you about today. That's why, you're so important because you're on the ground. And so I think a lot of times people don't see how policies work on the ground. They make up these laws, these rules, but they don't necessarily see how they are actually affecting the community. And one of the most powerful things was our conversation on Medicare versus managed care. And really people understanding what the difference is. Would you be able to tell us a little bit about, Medicare, managed care?
Sure. The major difference between Medicare and Medicaid and managed care is autonomy, if I should have to say that way. You have a choice of who is your provider, who provides care to you, where do you go to access care, okay? Medicare, you have a choice of choosing whichever provider that you want, whichever hospital you want to go to. Let's say that you're in Puerto Rico or in another state and you need healthcare. You can access healthcare. You pay the Medicare. Now, if you have managed care, it doesn't work like that. You can only access care based on if the provider is in the network. So you can only choose provider that's within the network. You can only choose facilities within the network. And most of the time, if they do not operate outside of New York State, then you cannot receive care. You consider out of network. You have to pay and then submit the bill to your managed care, and then they will now reimburse you, may or may not reimburse you. So it's just a matter of you have a choice. You actually controlling what happens to your life and actually controlling the type of services that you will be getting. Managed care, you don't have a choice. In fact, they are controlling what happens to you. Not even your doctor controls you anymore once you have managed care. It's all based on they said they have like a medical director and he makes all the decisions. He doesn't know who you are. He doesn't know who your needs are. All he knows is that when he look at what you need, he look at the money, what it's going to cost them to provide this care, okay? And if it's going to cost too much, then the service is going to be denied. So it's just your access to care, who provides the care to you. You give up your choice when you go to managed care.
Well, this is very confusing because a person who ends up on Medicare as a result of reaching a certain age, how do they get hoodwinked out of their services to be on managed care? And how do you stay out of it? Because my understanding is that they keep sending all of these mailers to you. And then they say, if you don't choose, we'll assign you somebody. So do we really have a choice? I don't know. How does that work?
You do have a choice. If you have the only choice that you don't have in New York State is if you have Medicaid. If Medicaid is your primary insurance, then you don't have a choice. You're automatically in New York State. You're automatically signed into a managed care company. But if you have Medicare, you have a choice. You don't have to go into a managed care. You're not automatically enrolled into managed care. The choice is yours. And why the choice is yours? Because if you have straight Medicare, you're responsible for 20% of the bill because Medicare only pays 80%, right? So most people will go to a managed care because the managed care is going to tell them, I'm going to pay you 20%. You don't have to worry about a 20% anymore, right? So if you go to the hospital, then you don't have to worry about that 20% because we'll absorb that, okay? You go to the doctor's office, you don't have a 20%. We would pay for that. So they take on that 20%. so you don't have to pay it. So most elderly people is going to go with that because guess what? They don't want to have a supplement insurance, which is going to cost more money for them because a supplement insurance covers the 20%, which is AARP. AARP is a secondary insurance, and most people get it to cover that 20% so they can stay within the Medicare streamline as opposed to going to a managed care. So most people who cannot, go ahead.
I just wanted to stop you right there. I'm so sorry to interrupt you, but if you could just repeat the last thing you said. What you're saying is that Medicare and managed care, if that 80% you don't have to worry about, that there are things in the middle besides AARP. Are there other things besides that? Like say you own a house or you have property, or you have a pension, would you still be able to get those services?
Well, the services, are you referring to Medicare or managed care?
Medicare.
Medicare is a freelance insurance. You're entitled to everything that you're supposed to get. You can own a house, you can own anything and still get Medicare because it's an insurance that's entitled to you because you have actually worked in the country, you have paid your taxes, you have worked your 10 years, you have done everything. So you are entitled to Medicare. This is what they give you for being a good citizen per se, right? Or working hard. So you get that. But they only pay 80%. So you are responsible for the 20% of what's left of that bill. So that's all they pay is 80%, and you responsible for 20%.
And they pay that 80% in 7 days, no?
Yes, they do. Yes.
They pay it quickly.
They pay really quick. That's why most people want that. They want the Medicare patient because it means that their revenue is coming in really fast.
Okay. And when you have managed care, does that revenue come in fast?
No. Sometimes they take up to 6 months to pay you if you get paid at all, because what they do is that they use a trick. They'll send it back to you. They'll say that the claim was not clean. You have to submit it again. Then they said another reason, and then next thing you know, they said then they call it untimely filing. So you're fighting with them just to be paid back and forth all the time, sending the claims back. They find all the different reasons and then end up it's out of the time frame, and you don't get paid. So they have a lot of games they play.
So how does that then affect your health care? So when you go to a doctor and they see that you have managed care, what is it?
Well, first of all, if the doctor is part of the network, then they'll take you. Some doctors, they just stop taking that insurance because they're not getting paid. But if they're part of the network, they'll take you, and then they'll fight with the network. And then after a while, they just stop taking that insurance. Like, for instance, I can just tell you at my facility, I stopped taking, there's an insurance called My Nexus, which is Blue Cross Blue Shield. I stopped taking it because they don't pay well. And now the ownership is on the agency to provide all these documentation to even get an authorization for the patient. This patient's request needs services. And before I can even get an authorization, I have to produce all of these documents. It's not worth it. No other managed care access for that. So we just stop taking them. So that's what happens. Like they make it so, hard on the provider that after a while you just say, it's not worth it because I have to wait 6 months to get paid anyway. So it don't make a difference.
Can you tell from your vantage point how this makes a difference in what kind of care people can have access to, even if you're accepting the provider? Do they have to get permission from the provider to give the services that the doctor wants to give?
Of course, the doctor is the provider. If I'm a provider and if I'm a doctor and I have a patient in my office and they have a managed care, everything that I want for this patient must be authorized. There's some services that may not need authorization, but most of the services on managed care has to be authorized. So what they can do is that it's called a referral. They'll give you a referral. They'll write up a referral and they'll say, hey, you need an x-ray, you can go to Dochi, okay? If they're called that anymore. And then you get the referral, you go to Dochi. When you get to Dochi, Dochi said, hey, You gotta wait. I gotta get authorization. Even though your doctor wants this X-ray, I gotta get authorization. Don't you get on the phone? They have to call up because they're the ones providing the service, so they have to get authorization to provide that service. To get on the phone, they call. They have the insurance company. The insurance company says, no, sorry, not approved. Guess what? You can't have the test done. You can do an appeal, but again, that's going to take a long time. So you go back to your doctor and you say, hey, they wouldn't do it. So then she'll say, let me look for another test that they might approve. You know what I'm saying? So of course, you end up getting something called fragmented care.
Thank you. I want you to say more about that, the fragmented care, because I think a lot of people don't understand Medicare, right? And that you can not only receive Medicare because you worked and you've turned, what is it, 65?
Yeah.
But also if you have a debilitating illness like cancer, right? Or
dialysis also.
Dialysis, you can also get Medicare. So this doesn't just affect the 65 or over, but it also affects working class people, but also people who are chronically ill. And what I'm finding, and I want to know if this is true, I live in a neighborhood that's extremely diverse. And when I talk to white seniors, they know, they say, oh, I would never switch. I hang up on them. They quite understand that they don't give up their Medicare, and they won't give up their Medicare. But if I go uptown, deeper into Brooklyn, I go into immigrant communities, they're actually being paid by managed care to manage their insurance. And many times these are people who can have access to the best doctors in New York City, but because they switch to managed care, they lose that access.
Exactly.
Is that correct?
Yeah, it's not only in your neighborhood. The folks that live on Ocean Parkway, no one touches their Medicare. They actually do something called a pool trust, and they get Medicaid to pay the extra 20%. It's called a pool trust. They pay the extra money, they get an attorney, and they do a pool trust. But no one touches their Medicare because they understand what it really means, right? So they'll never go into managed care. They'll do everything to get that pool trust, but they will never ever go into managed care because of the fact is that they already understand and they're taught that this is what happens. You have given up your right to get access to the care that you need. Now, it affects our community because they're not knowledgeable. They're not taught about what happens when you do this. And then they come into our community and they pay us. They said, hey, guess what? They give them a check every single month, and they figure that, oh, I'm getting this for free just for joining them, and they get accustomed to getting that check. So when it comes time to give it up, it's like I can't even talk to some of my folks about this because the first thing they said to me, what's going to happen to that check that I get every single month? What are you going to give me? I don't have anything to give you. Then I'm not going to switch because this is what they're accustomed to. As a matter of fact, right now, before I called you, I had a patient I'm working with. She actually, I went to open her case on December 22nd. And she was my patient prior to that. And I realized when I ran her insurance that it told me on the 1st of January, she's going to Empire Blue. So when I got there, I said, hey, did you know why did you switch from Medicare to Empire Blue? She said, I did not. I said, yes, you did. She said, I did not. And I said, okay, then let's sit down and call Medicare. So I called Medicare with her, and Medicare told her, yes, you switched. She said, I never switched. I never spoke to anyone. So they said, you did, because now as of January 1, you no longer have Medicare, and you no longer have your medication plan anymore. Everything is gone out of whack now. So she said, they said, okay, if you didn't make the choice to go to them, you need to call. She gave us the number. She said, you need to call them and tell them you want to disenroll. I actually sat there for 2 hours with this patient. We called. If I was an elderly, I was really angry because if I was an elderly, if she didn't have me, I wonder what would have happened. 2 hours I was on the phone back and forth, cutting me off, because Medicare told me you must get a number, a reference number. Finally, I got someone on the phone, and I told them that I called Medicare and we're going to put in an appeal against what you did to this patient. And she took all the information, and she said she was going to disenroll the patient. I said to her, "Can I have the reference number?" She was kind of taken back. "What do you mean a reference number?" I said, "I need a reference number. Medicare said I should get a reference number from you." So she gave me the reference number. I wrote it down. I didn't feel comfortable with it. I didn't feel it was a real reference number, but I wrote it down anyway. So come the 1st of January, of course, we ran, she called me, the patient called me, because of course now her insurance switched. It literally switched to this new insurance that she didn't sign up for. So I said to her, I said, "Let's call back Medicare. Let's give it about 5 days call back." So about the 10th, we called Medicare, and they're like, "There's nothing we can do. We didn't receive any information from your insurance that you signed up with." So I was like, look, can I speak to a supervisor? Because at this point in time, I'm involved, and I'm just not going to have it go down like this. To make a long story short, the supervisor said to me, she's gonna try to override it and put it in and all this stuff. So we waited. Now my patient calls me last week. She's like, "Joyce, I can't get no medication. I can't get nothing. She's like in tears. I can't go to my doctor. There's nothing that I can do." Call back Medicare. Medicare says to us, "We still haven't gotten anything. We already have an escalation on it. You have to wait." So then I said, okay, we call back. So we call back the managed care company. Same thing happened. They kept cutting the phone off. Finally, I told them, I said, "Listen, I'm calling. I've had enough of this. I'm calling the news. I'm calling elder abuse." I said, "I've had enough of this." Okay. I said, I'm not accepting this. So then I got to speak to someone. And you know what he told me? I said, I'm Black, but I was turning red. The lady did not even put in the request on the 22nd to disenroll her. Did not do it. I was like, and he said to me, I said, "Oh, are your calls recorded?" He said, "Yes." So I said, "Well, I'm going to make an official report on her, okay? Because this is really an abuse of the elderly, right?" So then he told me she had to now write a letter, and then we had to fax it to them. Mm-hmm. And on the letter, he told me exactly what we had to say. So I had to go to the patient's house. I typed up the letter for her, made her sign it. And now we fax it to them. They told us as of the 1st of February, she will be disenrolled, because right now she's within the 3 months. Because even though the open enrollment started, they switched over in January, they have 90 days that they can still switch. And after that, that's it. So she's within that same period. So they're able they're going to try to disenroll her. But this is just some of the things that they're doing. So the lady from Medicare said to us to put Medicare number in her phone. And that's something this is something that you should tell, or hold on a minute. You should tell all of your elderlies to put that number in their phone as a contact. So whenever someone call and say, "I'm calling for Medicare," and that number doesn't show up as a Medicare, you just hang the phone up. Okay? Yeah. But that number needs to be as a contact for all elderly people.
Tell me the number. I have something I could put up also. I'm going to give some resources at the end of this, because there's also a nonprofit that is now working with people to help you figure out. Some people have no idea that managed care isn't Medicare. That's how confused people are. They don't know. They think it's an extension of. And, Joyce, I want to ask you something, because is it what happened to Medicaid? Is that what's happening to Medicare? Because Medicaid also, wasn't it Medicaid was given directly to doctors, and now Medicaid is sort of managed care now? You can get like Blue Cross.
It's not the same thing. It's not the same thing. It's totally different, because you have to remember it's two different insurances. Medicare is given care. Medicaid is given aid. So Medicaid is based on an income, and Medicare is not based on an income. So it's two different things.
Okay.
So what happened to your client that you were working with? So it leads me to believe that there's some kind of telephone fraud, like somebody trying to call you, and any other kind of fraud, just outright fraud. Is that the case? Should somebody
Yes, it is.
charges against this industry?
Well, they know that. They know that because the lady from Medicare actually said to me, she said, it happens every single year. This is what they do. That's why she said that all you have, she told my, because the client was on the phone, because, I can't speak to them without them being on the phone. And she told my patient, she said, listen, and I'm going to look for the number and I'll give you I'll text it to you, Nancy. Okay. But what she said is that she said, put this number in the phone. And because when they, how they get them, how they get the elderly people, they said, I'm calling from Medicare. That's what the lady from Medicare said to me. She said, they tell you I'm calling from Medicare. She said, Medicare never, ever calls you. We never call you. And if we call you, this is the number we will call you from. Regardless if they're working from home, this will be the number we will be calling you from. So they get the elderly by saying, I'm calling from Medicare. Hi, I'm calling from Medicare. So they said, once you say, okay, then you're gone. That's it. They said just that one word, okay, hi, you're gone. So they told you, so she told our patient, you do not even talk with them. You just hang the phone up. But a lot of elderly people don't know this. Like, for instance, let me give you another example. I had a patient, he passed on now, but his daughter called me on a Saturday. She said, Joyce, I just got a call from Medicare and they told me, I said, no, you didn't. I said, no, you didn't. I said, Medicare did not call you and they shouldn't call you on a Saturday, okay? I said, whoever is that lady that you spoke to, you better call her back and you better tell her no and tell her this is fraud and I'm going to report you. So she did. She called her back and she said, this is fraud. You're not Medicare. Why are you calling saying you're Medicare? I'm going to report you. And the lady at that point in time revealed herself to her and said, yes, I'm calling from whatever insurance it was. And I'm trying to offer you something better. And she said, no, I'm not interested in nothing better. And I'm going to report this. And that's how she laid off of her. But if she didn't have the wits to call me and say to me, Joyce, listen, I got a call from Medicare because I was trying to get him into a special program. So she was worried if she did whatever, that he wouldn't get into the program. So that's why she called me. Now, had I not been working with her, he would have been switched over. Easy.
Mm-hmm.
Wow.
Mm-hmm.
So it is all about education.
And that's what I'm finding. The communities where there's wealth, they completely understand this concept. Mm-hmm. And African Americans, immigrants, wealthy or not, have no understanding of what is happening with their health care. And my only thought is that when people are facing these situations, they're either elderly or they're sick and they're in crisis. And so we're not hearing the voices of people suffering, not getting served. Many people, and what I've heard is that there's actually class action lawsuits that are going to be starting, that a lot of people that had managed care during COVID passed because they weren't getting any care.
Wow.
Yeah.
They needed to stay in the hospital longer. They were kicked out. They needed home attendant services, never got them. And people got sicker and died. And so many of the people, we were affected by COVID very much so. But when we talk about our healthcare system and where it lacks and where it falls, this is exactly the kind of policies that happen where we get not only the short end of the stick, we actually give up our rights. We give up the best healthcare service to get the worst. Or to get things that do not serve us. And so I'm so grateful for you to be on this call, to be able to sort of share these kinds of stories, because I really feel that this is also leads right into our mental health crisis, because these insurance companies are not paying for that either.
No.
They're not paying for people to even stay in a hospital.
Yeah, it's all about the money. you have to understand it's not about the patient. It's not about the needs of the patient. It comes down to the dollars. Because first you have to remember is that once these managed care companies don't, whatever monies that they have at the end of the year is divided up amongst the CEOs. So they get a big bonus. Okay. So the more services that they don't give you is the more monies that they have left at the end of the year. So that's just what it's all about. It's not about the patient care. It's all about the money.
And
the only two insurance that, go ahead.
Wait, and tell me how they get paid regardless. Like once you switch to managed care, they're getting a check. Is that correct?
Yeah, that what happens is that these managed cares, what they have done is that they've gone to CMS Medicare and said, hey, you know what, I can save you money. Because, of course, medical care is costly. So they said, I'll save you money. Let's say you do an average of, you pay out $12,000 a year. I can provide the same services that you would have provided, and it would be like $800 a year. So Medicare is looking at it like, I'm saving money. Instead of paying $1,200, I'm going to pay $800. So then they do contracts with all of these managed care companies because they're going to save them money. So now the managed care company comes out in the front and Medicare steps back in the back. Let me tell you, you will always have Medicare, right? Because during that enrollment period, you can go back. You have to stick with what you have until October, right? But you can always go back. And let's say that you do have, let's say during that year, you end up getting Medicaid, right? At that point in time, you don't need the managed care anymore. Medicare can step back in the front, and then the managed care is gone. So it's like that. It's lurking behind. It always stays behind. It's like Big Brother watching you, right? So it just steps back. It doesn't come out of your life. It just steps back. It plays no role in anything, but it's there. It's just watching everything, okay?
And so when you go to managed care, what happened was they said, okay, this patient averages about $12,000 in costs over the years. Is that what you're saying?
Mm-hmm.
And so
Yeah.
then they actually negotiate a flat fee of what they're going to be willing to allow you to have. So if you get actually sicker and your costs more this year, then what they do is just find ways to not pay for your health care.
Right. Because what happens is that, let me tell you, let me see, 7 out of 10 times, they're the winner. Because you know why? Most patients for the whole year may never go to the doctor, okay? Most patients, if they go one time, that might be it, okay? Or they may not go at all. They may not even access any type of medical care. But you know what? They get paid every single month from Medicare.
Whoa.
Thank you for saying that.
Well, so can you outline strategy for people who are approaching the years of Medicare, and how do they navigate this whole system so that they don't end up being hoodwinked in this way?
Well, you have to decide. It's an individual choice. You have to decide if you want to pay the 20%, if you want to, if you don't mind paying the 20%, and you can get an AARP, which is a supplemental insurance. You have to make that decision. You have to make that decision as an individual. Yeah, that's the number, I think. Yeah. You are the individual that has to make that decision. No one knows what your needs are, what you can afford. So it's definitely, that's an individual decision, but I think having the information to make those decisions can be helpful, okay? Because if you chose to go the route of having straight Medicare, you have to understand that you're responsible for 20%. You also have to understand that you can get AARP, which is a supplemental insurance, and they pay the 20%. So you never have to worry.
How much does that cost about a month for an AARP?
About $200 and something.
A year or
a month? A month. It depends. They sometimes they go on your asset. So it depends. I've known people that paid up to $300 a month.
Okay.
And yeah.
And then paying them the $300 a month, then your 20% is covered for any kind of hospital, and you get to go to the best of whatever.
Mm-hmm. Yes, for everything.
And then what about the pool gap? How do people do that?
So you have the pool trust.
Pool trust, sorry.
The pool trust, yeah. The pool trust is actually what a lot of the Caucasians are doing. They actually get the pool trust where they actually an attorney sets up a pool trust. Now there is something called, and I promised someone I was going to send them that information. It's a van that goes around, a legal van that goes around, and what they do, they help the elderly to actually set up a pool trust. Okay. And there's attorneys that do it, but they've gotten so slick with it because what's happening now is that people use the pool trust to get Medicaid, right? And you want that Medicaid because remember, Medicaid also pays for the extra 20%, right? So a lot of people, they do the pool trust and they may never access personal care, but they have the Medicaid, which covers that 20%. So a lot of places have gotten really slick. What they do is that they do the pool trust for free, and then now you have to join them and go with a managed care to manage if you need personal care. So that's what they do. They found ways to go around it. I mean, but anyway, there is a legal, I forgot what it's called. I think it's New York Legal, whatever services. And there used to be, before COVID, there used to be a van that goes around. It goes around to all of the city hospitals. If you belong to the city, if you go to any of the city hospitals, that service is free. But if you don't belong to them, the city hospitals, you can't do it. I know that Congressman or Senator, whatever his name is, Matu, they used to go to his office. They used to go to the guy, Then there's a guy on Avenue D called Jamani. He used to be on Avenue D. The van used to go to his office. So that he had helped a lot of people in the community because they were able to get the pool trust through him. Right. So this is a free service that they do for elderly. But I don't know what's going on. I have the number somewhere, but I don't know since the COVID, a lot of stuff has really not worked. So I don't know if they're still doing it. But this was a way that in our neighborhood that a lot of people were able to get the pool trust. In the other neighborhoods, they have attorneys. They have attorneys that just specialize in pool trust. They just do the pool trust. And they set up the pool trust. So how it really works, a little bit knowledge that I have, I'm not too knowledgeable on it, but how it works is that traditionally, if you have you're allowed, let's say you're allowed $800. That's how much money you're allowed on the Medicaid to get Medicaid. Traditionally, let's say that you're getting $1,200 or $1,400 a month. Normally, if the threshold is $800 and you're making $1,400, it's called a surplus. Okay, so traditionally you would take that surplus and send it every step. The city would say, "Hey, I'll give you your Medicaid, but guess what? That surplus is mine. You got to give it to me every month." So every month you will have to send a check to the city, and it's for that surplus amount of money. And you never see that money again. You never use the money again, but you must pay it every single month to keep your Medicaid active. That's how it was traditionally. Some smart person came up with the pool trust, okay? And with the pool trust, you are eligible for Medicaid. And that extra money, okay? So let's say that how is $1,400, right? Mm-hmm. And the threshold is $800. That's a difference of $600, right? Mm-hmm. So what they do with the pool trust, instead of sending that $600 to the city, what you do is that you take that $600 and you can now spend it on your bills, right? So you can now pay your light bill with it, your gas bill with it, your cable bill with it, your all that bills is now incorporated. So now you get it. So instead of traditionally sending the money to Medicaid and never getting a chance to ever touch it again, you now don't have to send the money. The money is now used for you to pay your expenses.
Wow.
That's interesting.
Well, so you've put a number here, Nancy, 800-333-4114, 800-333-4114, Medicare options, and you can call for information at the Medicare Rights Center.
Correct. And the Medicare Rights Center will talk to you. They'll advise you. They should be somebody you absolutely call if you get a phone call saying that you should switch. And these people can help walk you through all the steps. I also have a PDF that I'm happy to send to anyone that actually breaks down the pool trust. It breaks down Medicare, Medicaid, managed care. And we can share this out to our communities. I think what is critical is that our communities need to know that this is going on and that we do have some options. So I thank you so much. I'll say the number one more time, 1-800-333-4114, the Medicare Rights Center.
Excellent, excellent. So this has been so informative, and I'm really grateful for your joining us today, at least to begin to ignite in our minds that we can be more empowered in how we engage. And it might be more worthwhile for us to consider, even if we don't have a Medicare trust, that we would get better care even if we are paying that 20%. Because it seems like even the Medicare trust are accessing Medicare, you can lose a lot of your resources if you don't have access to the trust. So, which would probably be my option. But if you don't have the trust and you don't want to use the managed care, can individuals actually get the Medicaid, the actual assistance from the state?
Yeah, you can. You'll get the Medicaid from the state, but just keep in mind, right, is that the pool trust I like the pool trust. I'm being honest with you. I like the pool trust. Depends on who's doing it, right, and the purpose of doing it. So, because the pool trust, because guess what? If I go to Medicaid and I apply for Medicaid and I get it, and I have a surplus of $500, I got to pay that $500. That means I'm losing $500 out of my income every month, right? But if I get the pool trust, that same $500 goes into a pool trust, and my bills are paid from that $500. Okay. So in actuality, I am not losing anything.
So when you say a pool trust, what does that really look like, though? I mean, is it a bank account that
it is a bank account? It's a separate bank account.
Are other people putting their money in your pool trust, or it's just your pool trust?
It's just your pool trust. It's okay. Like, it's your pool trust
with a bunch of people, so it's just me. So my job would be every month to put $500 away in this account, but I have access to it.
Yes. Yeah.
What if I put it there and I just start spending it on all my stuff? That's fine.
Well, I don't like I told you, I'm not that knowledgeable about it. I'm trying to gain more knowledge about it, but it's online. You can find out all about the pool trust and how it works, and you can find out. You can do a whole lot of research on it, right? But
the lawyer on here. Yeah. You might have to get a lawyer on here to talk about the pool trust.
Yeah, you should. You really should, because the other day there was a lawyer. I was listening to a radio station. I actually called in and I asked her about the pool trust, and she said that she doesn't do it, but she does know lawyers that specialize in it. So it is an account. You're right. It's an account that's set up, and it's set up where the extra money goes into that account. And there's accountability with everything. So I guess you probably there's some other way, like, so that you show Medicare that you're paying that pool trust every month. But like I said, I'm learning about it more, because it's an option that a lot of elderly people need to explore now, because because the people on Ocean Parkway, they all got the pool trust.
So this pool trust, you could have an individual account for your pool trust. I thought initially you were talking about some kind of collective.
Yeah, me too.
Account.
No, it's an account. It's a separate account set up. It's a separate account set up where the extra money has to go. That money has to go into that account every single month, right? That's where the extra money goes.
And is it supposed to be there to pay for things if you do get sick? Is that its purpose?
Yeah.
That's amazing. That's really important information. We don't know this information.
Yeah. I don't know a lot about it, so I'm learning about it now, because, like I said, it's an option that I have to tell my patients about. So,
Well, I've gotten you on many calls. Have any of these faith leaders called you up to do presentations for them?
Well, I do a presentation every single week with, I think it's something life. I'm not sure. I do it every single week. I do it on a Monday. I meet with some faith leaders, and they actually
Was that
I
from the
do that every
call?
single.
Was that
Yes,
from the
from one of
call?
your calls. Yeah, they've used me, and we've moved on to making excellent choices about insurances,
Oh, that's
which
so good.
hospital, because now they want to be able. It's called Civics 101. That's what we actually
Oh,
belong. Yeah,
the
every
Church Women
Monday.
United.
Yes, yes.
They are
So
amazing.
so now we're moving on to making the community empowered about which hospitals we want to go to. Who's going to get your business? What you're going to do? How are you going to, if you got to make a choice, like who you're going to pick? If you got to make a, if you really have to pick a managed care, they're not all bad. Truly, I'm telling you, they're not all bad because I work with them every single day. I don't have a problem if I have a patient that has United Healthcare or Aetna. I have no problem accessing care for those patients, right? Those two insurances, I have no problem. For the first 60 days of service, I can service that patient and give them exactly what I want, what they need. So if it means that's actually like being a Medicare, I don't have to go and get authorization. So those are the two that we have seen right now that allows the patient to get the services that they need and be safely maintained in the community. So then I'm not going to say that they're all bad. You have to. That's why I want to let you know that that's when you ask me the question, like, what do you do? It depends on what you want to do. What are you looking to do, right? Because if you're actually not a person that's truly sick and I don't have any true medical issues, and then there are managed cares that do allow you to access care and without any issues. And like I said again, United Healthcare and Aetna are the two best that we have right now because we have a lot of managed cares that we work with.
Well, let me
But
ask you
those
this.
two,
Aetna and United Healthcare, do they have a variety of hospitals to go to? Because my question
yeah,
is also the type of doctor, the type of hospital,
they
the
do.
access to, okay, so you can
They
go
do.
to NYU Longhorn,
Yeah,
Wild Gotch, any of those, and they'll,
yeah.
okay.
I just don't know the doctors personally, like the PCP, the primary care doctors. I don't know who are in their network, but I can tell you right now, you had the access to institutions are basically all. You can go to any one of them. They accept those two insurances because they pay pretty decent.
Okay.
And they do allow you to have care. I mean, I've had a patient who needed. I mean, funny enough, no other insurance would do this, but I had a patient who needed a home health aide, and once she needed that aide with my nurse, she kept the aide for over a year. That doesn't happen anywhere else. I can tell you, no other managed care out there is going to pay for that. But she needed both the nurse and the aide, and she got them for a year. That doesn't happen in a managed care, right? So that's what I'm saying to you. Those two is what I've noticed that the patients can access care and get decent care. They get the physical therapy, and there's really no limitation for the first 60 days. It says no authorization. Once we can actually say they need it for ABCD, we're able to let them access that care.
Okay. Okay.
And those are, so like I said, they're not all bad. You just have to know which one. I would never tell my patients to go with GHI. I would not tell them to go with Emblem Health. I would not tell them to go with My Nexus. There's certain ones I would tell you don't even go there because the care that you're going to get is not worth it. It's limited. Health First, the same thing. They don't give you much. That medical director clamp down, boom, that's it, no more.
Wow.
Yeah, and I've seen this. I saw this during COVID. That's where this came up. There was
Mm-hmm.
a lot of people going into hospitals who had lifelong insurance. I know somebody who literally was part of a union. They owned their home for 51 years. They worked in the city, and they got COVID in their 70s. And this person was driving, going to the bank, going around, and the way he got COVID, people thought he had a stroke. His family thought he had a stroke. He didn't have the sniffles. He didn't have a cold. He just became very weak. He fell out of bed. He couldn't get up. And they thought, oh, stroke. They rushed him to the hospital and it was COVID.
Wow.
And he was in the hospital for 2 days and they started trying to send him back home. They were saying, oh, you're fine. You just have COVID. And the family saying, but he can't walk. He was able to walk just 2 days ago. And the hospital was just so pushy that literally the family became afraid to leave him in the hospital. The family literally, after fighting for him to stay, felt that the hospital was so negative that they felt like, you know what, let's take our guy out of here because they don't want him here. And there's nothing worse than that feeling of being in a hospital and they don't want you. And it wasn't until we started digging around, we realized somebody changed their Medicare. And what he thought he had Medicare, he never had Medicare. He had managed care. And so that's why the money that managed care gives to the hospitals, people don't want it. They want that bed and they want to put somebody else in there.
I know. And another part of that scenario, I don't know this person, but I do know that in the beginning, when they thought it was just pneumonia, people were getting all kinds of blood clots and strokes, and their brains were shutting down and having all kinds of problems. And they didn't have the capacity to properly diagnose. But in the meantime, they were getting a lot of money for all those intubation machines. And so they were forcing and sort of shuffling people into that therapy because they were making twice at least the hospitals were getting a lot of money back for it.
Yeah.
And instead of taking some of these other kinds of treatments.
Yeah.
So I'm sure that that's part of it because there's a preferential, they're looking for what they're going to get paid the most for. And that could very often be the diagnosis. If you don't fit this diagnosis, then we don't have time for you because we're not going to get paid.
Exactly.
Right.
I had a friend, I think what happens is we put doctors on a high pedestal, that they're sort of altruistic. These are great people. If you're a doctor, you're a great person. But we forget that it's a business at the end of the day. And the first time I saw that was helping somebody who I knew who's a dentist. And she opened up her own practice and she was, doing her clinic. And she said to the receptionist, when you make appointments, people who have managed care and Medicaid, not managed care, but this particular insurance, which I think was Medicaid at the time, they only get 20 minutes. Everybody for the cleaning, they get 20 minutes. Everybody else with this other insurance, they get 40 minutes. And I was like, well, why? That's not right. And she said, listen, I cannot fill up my day with Medicaid. If I fill up
they're the poorest pay. Yeah, they pay.
It wouldn't
don't pay
even
good.
pay for my dental assistant to do the work. So I have to mix it up. And the truth is, time is money, and Medicaid is not paying me. They're paying me pennies. So the fact that I even take this insurance and provide something is better than nothing. But she said, I can't live and pay my bills off of it. And this is a Black dentist, HBSU, grew up in New York, you know what I'm saying? And it's still a business. And so we have to realize that when we sell our insurance to another middleman, they're trying to make money. It's not about our health care. Period. They are out to make money, and that means less health care for you.
Yeah. And this is really important for us to realize because we can also realize the value of what we have. That the reason we're getting all these letters and emails and phone calls is because we have something that's valuable and we can begin to assess that for what it is and make choices based on that value.
That's right.
Also expanding that value to our own health. What's really important is getting a couple of dollars to get paid off to sell your health care. Is that really worth it? Especially in this climate. So I think that people have to make people can be empowered to make better decisions. Of course, we're looking at a community by and large that doesn't have, the excess resources. So we have to really manage it, but we have to manage our resources intelligently. So that's why I'm really grateful to have you share this information.
Yes.
Not a problem. Not a problem.
And I want to big
That's
up the
what I'm
fact
here
that,
for.
sorry to interrupt. I just want to big up the fact that you guys are the only Black-owned.
Yes, we are the only Black-owned certified agency. There's no other like us.
What I really would like for you to do is tell people about your business, your practice, how you serve the community, and if you would like, how people can make contact with you.
Okay, so actually, like I said before, we are a certified agency. We are the only Black-owned certified agency in the whole of New York State, the whole of New Jersey, the whole of Pennsylvania. There's no other like us around. We actually provide skilled care to the people in our community. That means we provide nursing, physical therapy, occupational therapy, speech. We provide and social workers, and we also provide home health aides. And for anyone, depending on what you need, what your needs are, we do all the legwork. If you want the services, you give us a call. We actually would reach out to your physician. We get all the paperwork. We reach out to your insurance. If you're managed care, we reach out to the insurance for authorization. We do all the legwork. Our goal is always to actually serve our own kind, because we actually know what your needs are. We've actually been there. We actually can help a lot. But that's what we do. We're right in the heart of the community. We're right on Utica Avenue between 4th and Farragut. We serve the whole entire Brooklyn. We serve the Queens. We serve the Rockaways. We also serve Nassau.
And what is the name of your organization? And if you have an email or website or number that people can reach out to you.
Yeah, the name of our company is Family Care Certified Services. And our email is familycare.com. And if anyone is interested in service, all they have to do is send us an email at intake at familyhomecare.com. That's our intake line, and we'll get the email and we'll reach out to anyone.
Excellent. So maybe it is you would eventually add to your services, creating these accounts for people to access their Medicaid.
Yeah, that's something to think about.
Service to provide for people.
We may need a lawyer.
Yes.
We need to help find one. Figure it out.
Yeah.
Well, Joyce, you've been so wonderful. I was so happy to have met you, and I'm so happy that you are continuing to share this information and really make sure the community knows about what's going on with their health care. So I thank you so much.
Nancy, I thank you, because do you remember, I told you I am not a speaker. I'm very camera shy. I just know, I know what I know, but I'm not a speaker. So you've taught me to just talk from my heart. So I appreciate you.
And that's talking from the heart is the best speaker. Anyone else is just an actor. I just want to let people know that we've been speaking to Miss Joycelyn Wills, and she is an MSN, BSN, RN, COS-CI. I don't know what all that means, but somebody will. Assistant Vice President, Administrator, DPS, Tri-Borough Home Care Limited, Family Care Certified Services, a division of Tri-Borough Certified Health Systems of New York, LLC. So I wanted to give you a proper introduction as we
Thank you.
Coming to the end of our broadcast. Thank you so much for being here.
Thank you.
Thank you for having me.
All right.
Okay.
Have a good one. Thank you.
You too. Okay, bye-bye.
Bye-bye.
It was my pleasure.
Oh, always. I'll talk to you soon.
Okay, bye-bye.